Hey guys, this is Dr. Zach.
And Dr. Maria from Absolute Treatment.
Thanks for joining us. We're just hopping on here today to start bringing some more information to you guys. And we've got an article that we're pretty passionate about, which is a comparison between surgical intervention and conservative rehabilitation for rotator cuff injuries. So what we see a lot in physical therapy is shoulder injuries, right? And we treat a lot of athletes, we treat a lot of middle-aged and elderly athletes as well. It doesn't really matter the age necessarily, that have shoulder injuries. And one thing that we've seen over the years is that there's an excessive use of surgical intervention when it comes to shoulder pain. And this can be scary, quite frankly, for the athlete or the individual, because typically what research is showing us is that one surgery can lead to another and lead down this rabbit hole of interventions. But this cool study came out that was comparing surgery and rehab, and it was looking over the long-term span, right? How long was it?
5 years. 5 years time span.
So that's a significant amount of time between an initial injury and the time the study was concluded. And so basically it was telling us the long-term effects. And so what did it all go into?
Okay, I'll explain. So basically, a study was done and it looked at 3 different groups. It looked at a group of people who had just surgery for rotator cuff injuries, people that had surgery and physical therapy to follow up after their surgery for rotator cuff injuries, and then a third group was just physical therapy to treat rotator cuff injuries. And what the finding was that there was no difference between any group in how their shoulder felt 5 years down the road. We've had studies looking in the past at 1 year and 2 year, but nothing to go out 5 years. So this is pretty big information, and it tells a lot of great things. Basically, you don't have to have surgery to get better from a rotator cuff injury. Physical therapy alone can be a successful result, and you may have the same outcome that you would even if you had had surgery. And that's saving money, time, and a lot of the other stress and anxiety that comes along with having to get surgery and heal and have your family help you during all those crazy times too. So we're really hopeful that we can help anybody with a shoulder injury, especially a rotator cuff tear, and the trajectory for physical therapy to treat rotator cuff tears is pretty bright.
And that's why I think it's so cool that we have like direct access, is that our patients can come directly into our clinic immediately upon injury, and we can get them better before they even have x-rays and MRIs, if that's possible. So that's where we're at as a clinic, is we're trying to lead from the forefront. We want to be your place to go where we can evaluate you, see what's going on, see what you need to do. If we need to send you for MRI, if we feel like we can get you better here in the clinic. So this is a pretty big study for us, and we're excited to be treating you guys and helping this community prevent shoulder surgeries and get you back to doing the things that you like to do.